A neighborhood tells us it's trying not to become numb to violence involving kids, as Aurora police announced their first break in the search for suspects from the drive-by that injured 6 students. 6,000 Coloradans have been on standby since the start of the pandemic. They're ready to offer their years of medical expertise. The state hasn't called a single one of them. A professor who studies public health wants to rebut the state's basic strategy that the unvaccinated basically get what they get at this point. And police pulling over the swerving driver quickly discovered the issue. Nuggets, delicious nuggets. Next. Aurora police and neighbors are begging for people to keep paying attention, to not let the shooting of 6 students in a drive-by outside school yesterday become something that we accept or stop talking about 24 hours later. Tonight, investigators released photos of the suspects' vehicles. Take a look. Black Chevy Tahoe, chrome door handles, roof rack, may have Colorado plates. And then there's a black Chrysler 300 with dark tint and chrome wheels. Police had asked for home security video from neighbors around Nome Park next to Aurora Central High School. A neighbor who lived across from the park for 8 years before moving away told us it's a nice neighborhood when the school's not in. Laura McLaughlin says her young cousin was at the park yesterday when the shooting started. 6 Aurora Central students were hit in the gunfire. Youngest is 14, oldest is 18. All of them are expected to recover. Everything police have said suggests that there were multiple shooters in multiple vehicles and quite a few shots fired. Our team out there today saw a vehicle pockmarked with bullet holes. McLaughlin says during her years living in that neighborhood, she often saw violence involving young people.
I've had multiple incidences where I've had to break up fights between these children. There's been multiple shootings. I've rushed children into my house that have been maced. It's happening inside the school. It's happening at the park. What's really scary is they're becoming numb to the violence because they're around it so much.
McLaughlin told us she's hoping Aurora Central can get some extra help on campus, like more school resource officers from APD. Colorado has a list of healthcare workers that they can call into duty if the pandemic gets out of control. 6,000 Coloradans, willing and able. Not one has received the call. I mean, you had hospitalizations jumping again today, near a record and rising, and we're down to under 100 available ICU beds. We know how stressed healthcare professionals are. Our Steve Steger asked the state why it's not calling on the reserves.
I went to New York for a month in April of 2020, right when the pandemic started.
Dr. Camilla Sassen's been in the thick of the pandemic since the beginning. She's been in the Dakotas, Texas, California too, helping out hospitals in states seeing massive surges in cases. Every time she deploys, she finds healthcare staff feeling the same way.
That sense of feeling overwhelmed, feeling like there's no end in sight, and then feeling like even though you're doing your best, it may not be enough. We have to send in that relief pitcher to just give you a break for a minute and give you a breather.
With Colorado's hospitals starting to hit that level, Sassen assumed she'd get a call.
Right when COVID started, there was a volunteer list where you could volunteer as a healthcare worker, whether you're a social worker, a physical therapist, a nurse, a doctor. And so a lot of us put our names on the list saying, look, whatever you need, put us in.
But Sassen says she hasn't gotten a call. Neither have the doctors she knows who signed up for that same list. The state health department says more than 6,000 people signed up as part of its disaster volunteer program. They've used about 3,000 of them at vaccine clinics across the state since February. But as staffing shortages plague hospitals, a spokeswoman for the health department told me they're still working out a plan to figure out how to connect volunteers who have signed up with facilities that can use them.
I'm hearing about FEMA coming in. I'm hearing about all these other things happening, but what can I do personally to help?
Sassen, who's an ER doc, says she and her colleagues who volunteered are ready to do whatever they're needed to do.
I have been in situations where literally I have, wheeled people to radiology. I have helped change their bed sheets. I have done whatever it takes to get that patient cared for. Tell me where you want me to be tomorrow morning. I'll do it.
State told me today that they are using these FEMA teams because they're federally funded, part of a grant, and they have an operations center ready to send people to fill gaps in hospitals with staffing shortages. They're using contracted healthcare workers there because they know that those workers will be able to do a 2-week shift rather than just work a day or two or even a few hours like a volunteer might in that case. But Dr. Sassen in this case is just saying it's surprising to her that there are a lot of people she knows who've signed up for this list, haven't gotten a call yet. We do know of one volunteer from that list who's being used in the staffing center. That's kind of the operations center for the state, where they're trying to figure out where the shortages are. And they're working on a process to try to connect volunteers with hospitals that might need them.
So this list came about when we were in that real panic point early in the pandemic, where it was how do we find people who know anything about medicine and get them in there? I mean, they were asking for retired doctors and nurses and folks like that. I can imagine if I'm a hospital that's at a crunch point and I have a choice between a FEMA team that's trained, ready to go, knows what they're doing with COVID, and, God bless them, some doctor who retired 20 years ago, I want the FEMA team.
Absolutely. Also, the FEMA team is already paid for. It's part of a federal grant that's out there. Same thing with the workers that the state is offering to provide through this fusion center that they have. Those are workers that they've paid to be ready to fill in and be ready to be there for a long period of time and be ready to do the work that needs to be done.
All right, Steve, thank you. Estes Park is one tough customer when it comes to wildfires. After facing down Colorado's second largest fire in history last year, a smaller wildfire today was met with calm evacuations and just cautiousness. 115-acre fire is burning south of town, and it's led to mandatory evacuations for Little Valley, Hermit Park, Meadow Park, and south to the Boulder County line. There's some voluntary evacuations as well. Firefighters think that there might have been some kind of electrical issue that started that fire, which is now 11% contained. The folks we talked to were pretty calm about the whole thing.
We have talked to the neighbors we've seen, except for a couple, and we did some reminiscing about past evacuations. You just sit around and wait until you hear some news.
There's space, plenty of it by the looks of that video, for evacuees at Estes Park Event Center and the LifeBridge Church in Longmont. Police reform is coming to Aurora through a legal settlement that forces the city to make some changes without admitting legal liability. This consent decree, as it's called, creates rules about how officers will interact with people in the community, especially people of color, how transparent the department will have to be about arrests and use of force, and how APD trains its officers. The settlement follows a report that found that Aurora had been engaged in racially biased policing. The report largely came about after the death of Elijah McClain in police custody back in 2019. Officers contacted McClain while he was walking home from a convenience store. He had done nothing wrong, but they threw him to the ground and put him in a carotid hold. Paramedics came to the scene and gave him ketamine to sedate him. McClain died several days later. Those officers and paramedics were eventually indicted for McClain's death more than 2 years later. The agreement, the consent decree with Democratic Attorney General Phil Weiser's office provides about 5 years of oversight for Aurora. First 2 years are for APD to change its operations and training, then 3 years of monitoring. Aurora City Council just has to sign off to get it moving, and they'll meet next Monday. Use of force by law enforcement in our state is also being closely scrutinized in a courtroom in Adams County. A deputy's charged with assaulting a handcuffed jail inmate. That incident led to Colorado's very first ever failure to intervene case. Criminal charges for the deputy involved and 2 others who didn't stop the use of force or report it. Marshall Zellinger's along now after following the first day in that trial. And Marshall, so I guess the question would be, are those 2 other deputies, would they be in the clear for not reporting the use of force if this first deputy on trial isn't found guilty of assault?
I'm learning very quickly that assault and excessive force are 2 different topics. Assault is about bodily injury. Excessive force is about using more force than is required. You've got one deputy, Andy McCormick. He's the one that's on trial, charged with assaulting a handcuffed inmate back in August 2020. You've got 2 other deputies who are also charged with assault and also for not stopping or reporting McCormick's actions on that inmate. Since I don't have the jail video yet, it's a little hard to explain, but follow me here. McCormick, that first deputy, he's the one on the far right, leaving with his attorneys at court today. The jury was shown jail video of him hitting a handcuffed inmate who was being held down on the ground by 3 other deputies. That inmate is Michael Cassidy. The deputies went into the Adams County holding cell because Cassidy had slipped his cuffed hands from behind him to in front of his body. McCormick's attorneys are expected to call use of force experts to testify what happened to Cassidy was a textbook justifiable use of force tactic. So what happens if a jury finds McCormick not guilty of assault? Does that mean the two other deputies should no longer face charges for failing to intervene?
There is a difference between assault and excessive force. Just because a jury renders a not guilty verdict on assault does not mean that the force used was justified.
The jury has not done anything yet. The case still has another day or two before the jury gets it. But what the jury did not hear from either side while Cassidy was on the stand today is that the county settled with him $300,000 to make sure a civil suit never happened. Kyle, those two other deputies with the failure to intervene charges, their trials are later this year.
Jury not going to hear about the cash payment to make the civil case go away.
No, that time is probably come and gone for that.
All right, Marshall, thank you.
We're forgetting the fact that all of us are impacted in one way or another.
A fresh perspective on Colorado's strategy to let COVID-19 race through the unvaccinated population. And the Nuggets made her do it. Police found the explanation perfectly plausible. That's next. Colorado's one-day drop in COVID hospitalizations lasted just the day. Back up today, more than erasing yesterday's gains. Though at least the pace of increase week to week in hospitalizations is slowing in this fifth wave. There are now 1,470 people being treated for COVID-19 in Colorado's hospitals. It's up 39 patients from the day before. You can see us approaching the all-time worst peak for hospitalizations. Our positivity rate's been inching down very slowly over the last week. We're nearing 10%, but we've eased back down to 9.6%. And we had one day over the last week that was below 8%. State leaders from the governor on down have made it clear that widespread public health restrictions are not coming back despite that situation because, their view, vast majority of those hospitalized are those who chose not to get vaccinated. They've opted in for this. We've heard the governor outline that rationale. I want to bring you a different perspective tonight from Dr. Jen Greenfield of DU. She's a professor of social work who studies public health. She wanted to remind Coloradans of what was so often said early in the pandemic. We're in this together.
My name is Jennifer Greenfield. I'm an associate professor at the Graduate School of Social Work at the University of Denver. I have a PhD in social work and I study the impacts of caregiving on household economics. Well, I know that a lot of folks felt kind of a rush of relief when the vaccines were authorized. Yay! Almost normal.
Today, I got to walk into our press briefing room without a mask. If you're vaccinated, you don't need to wear a mask at all.
I was frustrated from the start as we began to roll back the restrictions because we already were seeing Delta starting to surge in other places in the country.
The vast majority of hospitalizations are among that smaller and smaller group of people that are unvaccinated.
I think that there is maybe a misconception that the people who are catching COVID now are those who willfully chose not to get vaccinated and that therefore this is on them. Unfortunately, that disregards, first of all, those who are immune compromised, secondly, those who aren't eligible, and third, and I think really importantly, the healthcare workers and other people who are impacted when COVID surges. And so when we say that it's a pandemic of the unvaccinated, we're forgetting the fact that all of us are impacted in one way or another. I think that part of what has driven this pandemic is that we've lost this sense of community care. And so if we can get back to a place where we agree that we have common goals of staying healthy, maintaining as much individual freedom as we can, but in the context of keeping our families and our communities safe, then I think we could have a more productive conversation about these different choices that we need to make at the policy level.
The perspective of DU's Dr. Jen Greenfield through the lens of our photojournalist Foster Gaines. Dr. Greenfield thought that the bare minimum that we can do, elected officials and citizens alike, is to believe in the best available science. It's been late summer warm here in mid-November. Next viewer wondered if that's why the trees and plants are budding and whether we need to be worried about that. And it was nugs, not drugs, that were the cause of a driver getting pulled over. Thank goodness for small-town journalism. Next.
May I
I make a recommendation, point you to something that isn't ours, but I think is worth your time. Small newspapers are a gold mine of news nuggets, and the Durango Telegraph, not the Herald, Telegraph, had one about the actual nuggets of the chicken variety recently. This was a police blotter item reading, "Driver had a chicken nugget causing accident." Telegraph learned that a woman spilled her order of chicken nuggets on her lap, caused her to swerve, led a Durango police officer to pull her over, give her a ticket. It's good fun reading. It's a chance to support a small newspaper with your click. So we'll post a link to that story on the next Facebook page.
Windy and warm again today with above average highs in the 70s. It all comes to an end tonight with the arrival of a cold front from the north, and cold air is coming. Temperatures will be 30 degrees colder tomorrow with scattered snow showers, no accumulation, and not enough snow that we have advisories for travel. But be prepared for a chilly day, a cloudy start to the day with a few light snow showers that intensify just south and east of the city. And then we're back to a warming and drying trend. The snow model's not showing us much that's going to stick around, but it is a cold change. Speaking of cold, our low tonight 27, 20% chance of snow under cloudy skies. High tomorrow 40, low of 18. And then into the warmer weather we go, 50s and 60s for the end of the week and next weekend.
So we've had this oddly wonderful long fall, which Kathy suggests is about to end temperature-wise at least. We had leaves just recently coming off the trees and the color staying in our gardens due to the lack of a real hard freeze. I've also seen some spring plants coming up at my place. And our viewer Bria asked for expert help with a tree that's budding out in her yard in the fall. It shed its leaves as it always does in the fall, but she said she didn't remember it budding out like this spring style before the snow flies. We took her concerns to Tony Hahn, horticulturalist with Denver Commercial Property Services. And he says if we're seeing this, should not be alarmed, especially if it's a tree like that one, silver maple. It's not a result of our recent warm weather.
Plants are evolved to the point where they don't really depend on temperature. They depend more on day length to trigger hormones. I think you have to consider it's silver maple, one of the earliest trees to flower. This is not unusual.
Tony says his biggest concern this time of year with the warm weather that we've received is watering, as in make sure that you are watering your trees, especially maples, spruce, and pine trees, because they're doing new growth right now, new root growth, and watering them is really critical. It is a sign that is a warning to the claustrophobic. Plus your feedback next. It's a sign that is a little disconcerting on your way to go. Catherine was at the Florissant Fossil Beds National Monument when she came across the bathroom, and the sign appears to read, "Danger, do not enter, confined space, permit required." So the good news is the warning is for the locked underground chamber beneath the bathroom. The bad news is that sign means that somebody has to go into that underground chamber from time to time. Email us the signs that make you look twice. Next@9news.com is the email. You can always use the hashtag HeyNext on Twitter. Linda Phillips tweets in with an interesting comment tonight. Says, why do newscasters tell us what they're going to tell us before they tell us what they're going to tell us? So, Linda, what you refer to is a fairly common construction for people who make oral arguments or speak before groups or even pastors. And that was the earliest known reference to the speaking style that I could find. From 1908, 3 parts of a sermon printed in the Northern Daily Mail in England. A preacher there said, I divide my sermon into 3 parts. First part, I tell them what I'm going to tell them. The second part, I tell them. And the third part is, I tell them what I told them. The hope is that you'll remember the sermon, Linda. We'll see you next time.